telephone. Dr. Davis, telephone, please. Dr. Davis, telephone, please. Dr. Blair, Dr. Blair, Dr. J. Hamilton, Dr. J. Hamilton.
Hello, and welcome to Dr. Williams Clinic, where health meets knowledge. I'm Dr. Ola. Today, we are going to talk about hypertension, also known as high blood pressure. We'll cover what it is, why it is important, and how you can manage or prevent it for better health. Let's get started. So, how do we define hypertension? Hypertension is a condition where the force of the blood against the wall of your arteries is constantly too high. Over time, this can damage your arteries and increase your risk for heart disease, stroke, or other health problems. How do we read blood pressure? Blood pressure is measured in millimeters of mercury. That's millimeter mercury, and consists of two numbers. We have the systolic pressure and the diastolic pressure. Systolic pressure, the top number measuring the pressure when your heart beats, and the diastolic pressure, the bottom number measuring the pressure when your heart rests between beats. So normal versus high blood pressure. A normal reading is around 120 over 80 millimeter mercury, while 140 over 90 millimeter mercury or higher is considered hypertension. So let's talk about statistics of hypertension and how it has affected the world greatly. Hypertension affects about 1.28 billion adults worldwide, with nearly 46% unaware they have it. In the United States, almost half of adults, which amounts to 160 million, have high blood pressure, but only 1 in 4 manages it effectively. Globally, hypertension is a leading risk factor for heart disease and stroke, responsible for 7.5 million deaths annually, or 12.8% of all deaths. Despite its prevalence, treatment remains low, with just 21% of people having their blood pressure under control. So let's talk about the causes and the risk factors of high blood pressure. One is lifestyle factor, which is poor diet, lack of physical activities, obesity, excessive alcohol or tobacco use. The next one is age. The risk of hypertension increases as you get older. Genetics is the third one, which is the family history of high blood pressure can make you more likely to develop it. Another risk factor is chronic condition. Conditions like diabetes, kidney disease can contribute to hypertension. Then we have the stress. With long-term stress can lead to high blood pressure over time. So what are the signs and symptoms we need to watch out for? Because hypertension is often referred to as the silent killer. One of the reasons is because there will be no obvious symptoms. Most people with hypertension don't experience noticeable symptoms, which is why regular monitoring is important. In severe cases, some may experience symptoms like headache, shortness of breath, nosebleed, chest pain in extreme cases. Emphasize that these symptoms usually appear when blood pressure is dangerously high. How do we diagnose hypertension? One is blood pressure tests. Routine blood pressure checks are key. Readings of 140/90 or higher on multiple occasions indicates hypertension. Second way of monitoring or diagnosing hypertension is home monitoring. Many people monitor their blood pressure at home using digital blood pressure monitor. The last way of monitoring your blood pressure is regular checkups. I encourage you to have regular medical checkups, especially if you have risk factors like family history or existing chronic conditions. How do we manage hypertension? One way of managing hypertension is lifestyle changes. Under lifestyle changes, we have diet, we have exercise, we have weight management, we have limit alcohol and avoid smoking, and then manage your stress. The second way of managing hypertension is medication. In some cases, doctor may prescribe medications such as diuretics, ACE inhibitors, and ARBs, calcium channel blockers, and beta blockers. I will advise you to work with your healthcare provider to develop a personalized plan that balances lifestyle changes and medication. What are the complications that arises from hypertension being untreated or poorly treated? One is heart disease. Hypertension can lead to heart attack, heart failure, or other heart condition due to the strain on the heart. Another complication is stroke. High blood pressure can weaken or damage blood vessels in the brain, increasing the risk of a stroke. Third complication is kidney damage. Hypertension can damage the blood vessel in the kidney, leading to kidney disease or failure. Eyes damage. It can also affect the vessels in the eyes, leading to vision problems or blindness. The last complication I'm going to discuss is aneurysm. Blood vessel can weaken and bulge, potentially causing life-threatening ruptures. I'm going to stress the importance of early detection and consistent management to prevent these complications. It's for us to do regular checkups and regularly check on our blood pressure. What are the ways to prevent high blood pressure? One is healthy diet. Let's learn to stick with a balanced diet that is low in salt and rich in whole and unprocessed foods. Second is to stay active. Make sure you have exercise regularly as part of your routine. Thirdly, maintain a healthy weight. Weight loss can help prevent hypertension. Then, let's limit the alcohol intake and quit smoking. Lastly, regular monitoring. Let's regularly keep track of our blood pressure, especially if you know you are at risk. Thank you for watching. I hope this video has helped you understand hypertension and how to manage or prevent it. Don't forget to like, share, subscribe for more health tips. Stay healthy, and I'll see you next time. Stay healthy, stay informed, and I will see you in the next video.